to us for random and unexplained reasons.
Yeah, I think it's really important to consider what you're calling damage, right? And we know that that damage happens on multiple levels. So it happens to our minds and the ways that we're thinking about the world, as well as our emotions and our behaviors and our actions, and how we're able to respond to ongoing stressors, as well as the stressors that we're currently presented with, whether that's in our community or on social media or on the news. And what we do know now is that individuals who are directly experiencing instances of police brutality, as well as those who are watching it, as well as even just having these conversations that are, people say, triggering, right? That's one of the symptoms of PTSD, or what we now know as racial trauma. So being triggered, right, that leads to rumination, that leads to thinking that this can happen to you, that leads to hypervigilance. And these are classic symptoms of PTSD that says, I'm experiencing increased worries, I'm experiencing anger in response to this, and this is a natural response that occurs. So if we think about the impact that those thoughts have on our feelings, right, you can start to feel your heart racing even. And we know that that leads to hypertension, high blood pressure, heart attack, and right, death. It might not take the 3 days that it took for Tyree, but for some of us, we're getting these days and years cut off of our lives.
You know, I have not been able to bring myself to watch the video of what happened to Tyree Nichols. And that's unusual for me. You know, it's my job as a journalist to get as much information as I can about the things that I'm presenting to the audience and talking about with the audience. And you know, as hard as it was to watch videos in the past like this, I always did it. I can't get there with this one, and I don't think I'm alone. I know that I talked to John earlier in the week, and he said he was also not watching.